This Memorandum of Understanding is for the Consumer Directed Personal Assistance Program. CDPAP is governed by the New York Department of Health. CDPAP allows chronically ill and/or physically disabled individuals receiving home care services greater flexibility and freedom of choice in obtaining such services. To participate in the CDPAP program, a consumer must understand and agree to their role and responsibilities, and the role and responsibilities of Public Partnerships LLC, the statewide fiscal intermediary. The purpose of this MOU. This MOU explains the responsibilities of the person receiving services, the consumer, the statewide fiscal intermediary, Public Partnerships LLC. Responsibilities of the consumer. The consumer and their designated representative, if there is one, understand and agree that they are responsible for the following. 1. Working with their local Department of Social Services or managed care organization to develop a person-centered service plan and plan of care and update the person-centered service plan and plan of care at least once a year or when a significant change in circumstances occurs. 2. Following their person-centered service plan and plan of care. 3. Contacting their LDSS office or MCO if they have questions about the person-centered service plan or plan of care. 4. Being available and present for any scheduled assessment or visit by the independent assessor, examining medical professional or LDSS office staff member. 5. Recruiting and hiring enough PAs for the consumer's care needs. 6. Making sure the consumer's PAs are qualified and remain qualified to work. 7. Training, scheduling, and supervising the consumer's PAs, ensuring a safe home environment for the consumer to receive services. 9. Staying within the limits of the consumer's service authorization. The service authorization is based on the consumer's person-centered service plan and plan of care. The LDSS office or MCO will send a copy of the consumer's service authorization to PPL. 10. Creating and maintaining a backup plan to ensure that services continue when a PA cannot work their shift. 11. Reviewing the plan of care with each PA that is hired. 12. Making sure that the consumer's PAs accurately and timely submit required registration documents to PPL, safely and correctly do only the tasks listed in the plan of care, work only the number of hours the service authorization allows, and accurately and timely report their time worked through PPL's Time for Care app or another approved method. 13. Following all employment laws. 14. Treating the consumer's PAs fairly and honestly. 15. Ending a PA's employment if that is necessary. 16. Telling PPL if a PA is no longer working for the consumer. Telling PPL and the LDSS office or MCO within 5 business days of any change in the consumer's status or condition. This includes, but is not limited to, hospitalizations, address and telephone number changes, and out-of-state travel if the consumer will be receiving services out of state. 18. Not using CDPAP services outside the United States or its territories. 19. Participating in any CDPAP required assessment to ensure that the consumer remains eligible for CDPAP services. 20. Following all other CDPAP requirements. Responsibilities of Public Partnerships LLC. PPL has been hired by DOH to serve as the single statewide fiscal intermediary for CDPAP. In that role, PPL is responsible for the following. 1. Assisting the consumer by providing guidance about the rules of CDPAP. 2. Serving as the joint employer of the consumer's PAs. 3. Issuing paychecks to the consumer's PAs. As part of this, PPL will withhold from the PA's paychecks federal, state, and local income tax consistent with the PA's election and Social Security taxes. Ensuring that a PA has completed all the required registration paperwork before they start providing services. 5. Providing PAs with benefits including health insurance, unemployment insurance, and workers' compensation insurance. 6. Processing wage verification requests, paid family leave claims, and Family Medical Leave Act claims. 7. Monitoring the consumer and DR if there is one to ensure that they are able to fulfill their CDPAC responsibilities. Notifying the LDSS office or MCO of any circumstance that may affect the consumers or the DRs, if there is one, ability to fulfill their CDPAP responsibilities. 9. Ensuring that all services provided meet the cultural and linguistic needs of the consumer, of the DR, if there is one, and of the PAs. 10. Providing training for consumers, DRs, and PAs. 11. Maintaining a personnel record for PAs. Each personnel record shall include, at a minimum, copies of forms used to register, information needed for payroll processing, and providing benefits. 12. Maintaining records for each consumer, including copies of this MOU and documents from the LDSS office or MCO, including service authorizations. The right to end this MOU. This MOU will end if the consumer voluntarily withdraws from CDPAP, the consumer no longer qualifies for CDPAP, or the consumer or their designated representative cannot fulfill CDPAP responsibilities.